So I'm really honored to share my perspectives on health economics, especially how exposome research is going to facilitate the more precise estimations of the health outcomes with the highlight of the importance, potential rules on investment, decision-making on investment. So my presentation will include 4 parts. So the first is the overview of the health economic evaluation, and then is this environmental exposures and their health and economic impact, and then how important is the exposome research in determining exposure outcome relationships, and finally the policy implementations. So let me start off with the overview of health economic evaluation. So basically, the fundamental question, the evaluation is which intervention is most worthy to invest. Is really regard to investment, because the resource is always rare. The budget is always limited, so the policymaker really keen to know which investment is worthy and to earn and maximize the health outcomes. So basically, the evaluation compares the cost, or the input. The input is the resource invested. And then the output. The output could be effectiveness, which could be a natural or physical indicator, such as life years gained. And then could be also utility. So the utility is the comprehensive measurement combining both quantity and quality of life years. And also the benefit, which is monetary outcomes. So by comparing the outcomes outweighing to the in cost or input, the incremental cost effectiveness will be calculated, and this is called ICER, incremental cost effective ratio. So this is the base concept of health economic evaluation. So the mechanism is that you have several options. Compared to no intervention or state call, then the intervention is expected to earn more health outcomes. And then you compare the cost invested and then the acquired health impact, which is often measured by generic indicator, which is called quality adjusted life years. And then you can you can acquire the cost incremental ICER cost effectiveness ratio. For this indicator is an important metric for the decision. Yeah, here it is. And so this comparison of several interventions targeted by policy, and by calculating this incremental effectiveness ratio, then you can make the decision. So what's the modeling look like? So it could be depending on the availability of data and the question raised from research and also the policy arena. The modeling could be either simple or really sophisticated. But if the evidence is concrete enough, and we can just project the health outcome in long term, and this will really help the investment, the budget use by showing the really compelling health outcomes gained. So the modeling is start from real world problem, or those questions arising from policies, from research, and you need the factors and chain parameters, which is often a variety of exposures. And by using the evidence related to exposure outcome relationship, you can project the outcomes and impacts. And this is the structure of the modeling. So if we zone in the specific part of the model, and this is just a fraction of the model, just like a piece of puzzle, and it just include the exposure outcome relationship. So this exposure is like yes or no, and various factor A, factor B, and it could be really just like a branch of tree, and it could be really sophisticated when you include many exposures, as many as possible, providing the evidence is concrete enough. So I will highlight the environmental exposures and their health economic impact, which is really crucial for the model. So decision making just start from these evidence on the exposure outcome relationships, because it really enables the quantification of not only short-term but also long-term health impact. So by comparing the cause and effectiveness or benefit of different interventions, not only in short term but also long term, then you can this is a very fundamental thing for the policymaker. This compelling, you show the compelling evidence on how the intervention will create a large amount of health impact, and this will be used for justifying the investment. And also, policymakers are really keen to know which interventions should be prioritized. So the result will help identify which exposures pose the greatest risk and which interventions will help the most significant health benefit. And let me show example of the global project, which is called disease burden, global burden of disease, GBD study, which is launched by University of Washington and World Health Organization jointly to quantify the overall disease burden at the global level. And so in the project, the disease burden of a variety of diseases and also the risk factors has been calculated to inform the policy making. And regarding environmental exposure, by generating evidence regarding exposure outcome pairs, I guess there is now about 800 pairs generating from the best availability of the evidence. Then the disease burden at the global level and national level has been used for policy. And this is just show that just pick up the major health environmental exposures, and where you can see air pollution. It's like this. Okay. So the air pollution really contributable to a variety of these diseases, and then the overall disease burden attributable to air pollution, and also the other major environmental exposures. So it's just visualize the overall disease burden, the impact, the health impact. And by using the established exposure outcome relationship, the disease burden attributable to environmental exposure could be calculated. This is an example of dementia. So by using the published results from systematic review, my team just calculate the disease burden attributable to dementia by using the metrics to understand the full impact of these exposures to dementia, which is called the population attributable fraction, or PAF. Which is the estimate of proportion of cases that could be prevented if the risk factor, if the exposure were eliminated. So by calculating the disease burden, so you can see the reducing environmental exposures could really reduce the significant proportion of disease burden, especially in Japan, where it's a super aging society, and disease burden of dementia is really significant, and this environmental exposure will be a big thing. So this is fundamental part for the policy suggestion. But meanwhile, I also realized some challenges in this measuring, in assessing and quantifying exposure outcome relationship. So the first one is it could be complexity in the mechanisms, because affecting health through because the exposures just affect health through various pathways, and these mechanisms can interact each other. And with other risk factors, sometimes they just intertwine each other, make it so difficult to isolate the specific impact of the single exposure from the just confounding factors. And also the time lag is there because many health outcomes, especially those chronic diseases and also the dementia, which is have a long-term long-lasting relationship during across life stages. So this time lag makes it difficult to just establish the direct causal link and quantify the long-term impact accurately. And also the data could be driven from different sources, making integration a challenging thing. So when you try to increase the preciseness of the estimation, the data will be really crucial. So, but in this case, the data, because the data from different sources, then you really need to make the linkage, and estimate the combined effort on the health outcomes. So I think this is the Exposome research are expected to solve the problem, to help the problem solving, because it really there has been a progress in the measurement of the exposure. It's really helped determining precisely the exposure and outcome relationships. So, because you are experts, I'm not dive deeply into the exposure research. But what I like to highlight is I like those traditional approaches that just focus on specific exposures or risk factors. The exposome research just consider the accumulative and interactive effect of those multiple exposures on health outcomes. So it'll bring the bigger picture and more comprehensive picture to measure the exposure outcome relationship. So this has a great impact to the health economic evaluation, because considering the broader range of exposures and their impact on health outcomes, then the model will be more precise and in covering more information, covering the different various life stages, so make the estimate more precise and accurate. So I just keen to the current trend of exposome research, though I'm not an expert on this, but I just realized that there has been a longitudinal cohort studies as you presented, and really learned a lot from this, just following individuals over time to measure the exposure at different life stages. And these studies just provide invaluable data on how these exposures accumulated and interact to influence the population health throughout the life stages. And also with advanced technologies such as biomonitoring and omic technologies, the exposures could be measured more precisely by identifying, the pathway and the systems. And also, I'm really keen to the application as well, because this result has been applied to the precision public health. Because intervention with the identification of more exposures precisely, then the intervention could be tailored based on individual exposure profiles, which ensure more effective and personalized prevention strategies. And regarding incorporating, so it's really important to incorporate these new findings into the health economic evaluation. Just because the improved preciseness of the exposures of the measurement, and how to incorporate this data. So besides these traditional methods like systematic reviews or meta-analyses or simulation models, I will highlight the data science, the potential role of data science like big data or machine learning, because in enabling more comprehensive analysis of the complicated data set. So this is the current trend of the data science in dealing with the complicated data. So by using, for example, this is some major types of machine learning methods, to analyze the exposure outcome relationship, which is really overcome the limitations of the traditional simulation modeling method. It just improved the accuracy and precision, and also it could, unlike those traditional ones, it could be dynamics and adaptive, and handling non-linear relationships and quantify the uncertainties. So this is the blessing part of the emerging technology of data science. And I also realized some health economic studies alongside the current exposome data. So this is just briefly review the some exposome research project, and really find the health economic studies as a result. Start from the result when the health outcome released, like child health and development and chronic diseases. I think each project just focus on different diseases, but based on the result finding on the outcomes, then health economic evaluation just follows. So which is I think this is an emerging trend that the health economic evaluation could be starting from and then generating more precise data or precise evidence for the policy. So this will be my last page, which is the policy implications. I think policy, just recently we emphasized the evidence-based policymaking, and evidence is the concrete data, concrete figures, not just merely related to the the experiences. So the evidence-based decision, when we emphasize the evidence-based decision making, we really need this evidence to first identify and quantify the effectiveness of the intervention, and also the cost-effectiveness of the intervention, and also the social economic impact of the intervention. So this intervention targeting exposure identified as having a significant health impact are expected to be to get more funding, and resource allocation should really consider the effectiveness, should consider these kind of evidence. And also, this evidence help addressing the disparities or equity issues, especially for targeting those vulnerable populations, precise when these populations are precisely identified. So I think this is the power of exposome research. And by leveraging these advanced methodologies, then we can enhancing the analysis of more complex and complicated exposure outcome relationships. So just like big data and machine learning, and this is when we harnessing this emerging technologies, we'll get more precise evidence informing policymaking. So the last part, I will highlight the global collaboration. So because this is really related to multifaceted or multidisciplinary approach, let me just collaborate together to make the evidence more precise. So I'll stop here. Thank you so much.
Thank you.